Today's interesting topic is Vermiform Appendix. Vermiform Appendix begins on the posterior medial aspect of the cecum. It's very tiny, but the length can vary from as minimal as 2 centimeters to as long as 20 centimeters. On an average, it is 9 centimeters in length. It is an intraperitoneal organ. It is a part of large intestine, but unlike the large intestine, the various features of large intestine are absent in the appendix, that is hostrations. You can see that there is no circulations in it, they are absent. Appendices epiploicae, they are absent, that is peritoneal fold filled with fat, it's absent. Tinea coli, all the tinea coli will converge towards the base of the appendix. It's present in cecum but not present in appendix. This appendix is attached to the posterior layer of the mesentery by a fold of peritoneum called as mesoappendix. The mesoappendix acts as a plane through which the appendicular artery, which is a branch of ileocholic artery, sometimes a branch of posterior cecal artery, can enter the plane to supply the appendix. Appendicular artery supplies appendix from the base towards the tip. Rarely there will be an extra artery, it's called as artery of Sheshachalam. Its author is a doctor from Tamil Nadu. His name is there in Gray's Anatomy. It's called artery of Sheshachalam. It's an accessory appendicular artery present in Indians, majority of the Indians. So the surgeons have discovered this extra artery. That is also a branch of superior mesenteric artery. The appendicular vein drains into the superior mesenteric vein, which ultimately joins with splenic vein to form the portal vein. The nerve supply of the appendix, the sympathetic nerve, is coming from the lateral gray horn of T10, 10th thoracic segment, which forms superior mesenteric plexus, and through superior mesenteric plexus it supplies the appendix, whereas the parasympathetic nerve comes from the vagus nerve. There are various positions of the cecum and appendix, mainly the appendix position I am talking of now. This appendix, the tip of the appendix is free to move, whereas the base is fixed to the cecum. So whatever the tip points, so in majority of the case it will point upwards, okay, it's called 12 o'clock position. It will be behind the cecum. I'll show you other pictures in which you can see those things. It's called retrocecal or retrocolic position. It's the most common position. 65% of cases will be retrocecal. By the side of cecum we'll call it as paracecal. 10 to 15% cases are paracecal. Now this position, what you are seeing, it's pointing on spleen, so it's called the splenic position of the appendix, which is 2 o'clock position. Okay, I will show you the next diagram in a clear view. Spleen is there actually over there. See this. See, spleen is here. Okay, here you can see the gloved hand, that is spleen in the upper corner. Okay, just observe, I will just zoom out. See the appendix is pointing at that area. See, it's called the splenic position, or the, it can be pre-ileal and post-ileal. You can see here this forceps holding the appendix, but behind the forceps you can see the terminal ileum. So in this case is a post-ileal position. Rarely the pre-ileal position will be there, and that is a dangerous position of the appendix because it can cause intestinal obstruction, intestinal irritation, and the infection of the appendix can also spread to the small intestine. That's why it's called the dangerous position of the appendix. This appendix is now pointing the spleen, so it's called the splenic position of the appendix. See, it's pointing the spleen. Another appendix is pointing the promontory, so we call it as promontoric position of the appendix. This is a promontoric position of the appendix. You can see it's facing the sacral promontory. Okay, then we'll move on to this. Yeah, see here. This is the cecum. We have seen the appendix is another case. We are seeing the appendix behind the cecum. This is the most commonest position. It's called retrocecal or retrocolic position. If it was by the side more laterally, we can call it as paracecal position. Okay, this will paracecal position. By the side we can call it as paracecal. Okay. Then if it is facing the promontory, we can call it as promontoric position. See this clearly. See this appendix, you can see clearly the variation in the size. See, this is really long, okay, long and tortuous, like a snake. Okay, here it's short and tiny. See, So it's short and tiny. It is facing the promontory or more on the pelvis, bony pelvis it's facing. See, it's facing this pelvic cavity. Can you see? This cavity, can you see down? Okay, brown color cavity is there. No? Muscles are covering the pelvis. So you can see this is facing more, the tip is more pointing towards the pelvis, which is the 5 o'clock position, pelvic position. Rarely one more position is there, 6 o'clock position. Downwards it will be facing this ligament, white shiny ligament is there. No? It's called inguinal position. Inguinal position of appendix is extremely rare but possible. So these are the various positions of appendix. To summarize I'll just show you that and then start. Yeah. Retrocecal or 12 o'clock position, paracecal or 11 o'clock position, then promontoric or 3 o'clock position, splenic or 2 o'clock position. Splenic can be pre-ileal and post-ileal. Then promontoric 3 o'clock position, then pelvic 4 o'clock or 5 o'clock position, then inguinal 6 o'clock position. These are the various positions of the appendix. The maximum point of tenderness in case of appendicitis. Appendicitis is an inflammation of the appendix. It occurs whenever the inflammation, when the appendicular lumen is blocked either by the fecal matter, the undigested food material, or by a foreign agent, or by the worm, or by the infection in the appendix, in the lumen of the cecum, or foreign agent blocking the appendicular lumen. This results in appendicitis. In the initial part of appendicitis, pain is referred to the umbilical region. It's called referred pain because T10 segment of spinal cord is supplying umbilical region. Appendix is also supplied by T10. So the visceral afferent goes through, sympathetic afferent goes through T10 through the spinal cord by sympathetic afferent. Efferent comes via the somatic dermatome and comes and ends in the umbilical region. This results in referred pain in the umbilical region. Subsequently, the infection spreads from the appendix to the surrounding parietal peritoneum. The pain is felt in the right iliac fossa. That is called shifting of the pain. Other signs and symptoms of appendicitis includes tenderness in the right iliac fossa. Subsequently, guarding, that is muscle contraction. Patient will have a loss of appetite, that is not able to have food, nausea, vomiting. There may be signs of intestinal obstruction but can result in peritonitis, pain abdomen, nausea, vomiting, and fever. Fever is a sign of infection. So all these are signs and symptoms of appendicitis. Majority of the patient are in 18 to 25 years of age group, youngsters, and they may require a removal of the appendix because appendix can rupture resulting in peritonitis, that is inflammation of the entire peritoneal cavity, which is a dangerous condition. So majority of the patient with appendicitis require appendicectomy, meaning removal of the appendix. Thank you for watching and learning from Logic Medico. Kindly subscribe to our channel, recommend this channel for other friends, and share this video with your other friends. Thank you once again.